Okay, this is from the book Dr. John Mcdougall, The Doctor Who Fought for You. We're talking about autoimmune disease part 2. So starting out with rheumatoid arthritis. Rheumatoid arthritis typically improves with the Dr. Mcdougall diet. Mcdougall has lots of testimonials at his website, drmcdougall.com, of patients who had dramatic improvement with the vegan diet. I've seen video movies of them. He also has a collection of Star McDougalers. I was actually a Star McDougaller at one time for losing a lot of weight. But rheumatoid arthritis patients, and I've seen their interviews and stuff, they now move their hands quite well and whatnot. The patients who switch to it, they usually experience dramatic improvement. Rheumatoid arthritis didn't even exist in the world before 1800. It was very rare in Africa, almost no reported case before 1957. After 20 years with rheumatoid arthritis, typical patients is disabled or dead, treated with medications. Avoiding gluten and soy can also help some patients to improve from inflammatory arthritis. The worst food that's most likely to make a person have rheumatoid arthritis is dairy. Dairy is a terrible food for causing autoimmune disease. It's associated with type 1 diabetes, multiple sclerosis, rheumatoid arthritis. Okay, so what's the McDougall diet? It's just basically a low-fat vegan diet with no oil. Okay, this is from the Dr. Mcdougall newsletter, December 2014, about rheumatoid arthritis and meat. And I've seen a lot of those cases. They're quite impressive. And it's sort of, to me, like if I had an autoimmune disease, what would I do? Number one, I go low-fat vegan, no oil. Okay, that'll probably cure your leaky gut. Avoid all the things that cause leaky gut. That'll probably get better. If you haven't fixed it by then, I would avoid the chemicals, things associated with causing autoimmune disease, things like GP on the non-organic food, things like F- in the water, things like volatile organic compounds, and see how that goes. If you still can't fix it with that, I would try an elimination diet. If you still can't fix it with that, then I would consider all that omega-3 stuff. Okay, and that still doesn't work, then I would consider those drugs, but only then. Okay, the O3s will suppress your immune system. Okay, here's one thing. 10 cases of severe, mostly rheumatoid arthritis cured by the McDougall diet. Okay, schizophrenia, per Dr. Mcdougall, is possibly an autoimmune diet. The global distribution of schizophrenia parallels the Western diet. You look at the global distribution of disease. You just type it in, global distribution of a disease, and you'll see they've figured these things out. Autoimmune disease, they map towards cold weather where people eat more meat. And I think it's because of the cold weather, not because of the latitude and the sunshine. Because when you looked at multiple sclerosis, you would see it. I think it was in Norway, for example. The people in the coastal areas had very little MS, for example, because they weren't eating any dairy. People in the dairy farms more central in Norway had a lot more, even though the latitudes weren't that different. Okay, let's see. Global distribution of disease for schizophrenia parallels Western diet, as well as diabetes, coronary artery disease, suggesting they're related to diet. A guy named Malcolm Peat wrote a paper about this in the British Journal of Psychiatry in May 2004. The Western diet's also associated with increased rates of depression. Okay, that's from Dr. Mcdougall newsletter on schizophrenia and depression. Okay, these are just other things associated with autoimmune disease: scleroderma, thyroiditis gravis, Hashimoto's, ulcerative colitis. Okay. Problems with the eyes like uveitis and vitiligo. So the point of all those names, name dropping, is just that a lot of diseases are associated with autoimmune disease. So it's so obvious. You want to eat your fiber, avoid leaky gut, so you can avoid almost all these problems, if not all of them. In 1978, Arthritis Foundation put out a brochure that said there is no special diet for arthritis. By the way, whenever I hear foundation for a disease, think about it. They're always fake, and they have to be if you think about it. If you made a foundation for a disease, you want to make money, make it a nonprofit, whatever, you want donations, what happens if that disease is cured? You lose all your money. So it doesn't make sense for a foundation to actually want the patients to get better. Patients have a tremendously difficult time for that, okay? And you have to accept the fact no one cares about you. I'm not trying to be mean. I'm trying to help you, because you need to get that through your head that no one cares about you. You're just a poor pro and no one cares about you. Once you realize no one cares about you, then you have a chance to understand, gee, I have to help myself and figure this out. And once you do that, you got a good chance. Okay, so the brochure from the Arthritis Foundation said there is no relationship to diet and no food can do anything to help you with arthritis. No food causes it. No specific diet can cure it. And then it says, food fanatics and peddlers of health and natural foods may tell you otherwise. Well, I, Dr. Mcdougall, am here to tell you otherwise. The brochure is wrong. The science shows otherwise. Everybody knows that a high meat diet causes gout. If you look at Asians and Africans where they eat plant-based diets, They hardly ever get DJD, osteoarthritis, also called degenerative joint disease. Why is it that osteoarthritis is rare in people in Asia and Africa where they eat plant-based diets despite doing physically heavy labor? But it is common in Americans who don't do much heavy labor because it's the food. Okay. Some researchers believe that rheumatoid arthritis did not exist anywhere in the world before 1800. Inflammatory arthritis was once rare or non-existent in rural populations in Asia and Africa. As recently as 1957, not a single case of rheumatoid arthritis could be found in Africa. This is all from Dr. Mcdougall's newsletter. Whereas nowadays in Asia and USA, the blacks have the highest rates of lupus, a very common autoimmune disease associated with autoimmune arthritis. Up until 1980, about 90% of the diet in Asia was rice. Prior to 1980, less than 1% of Chinese had diabetes. Now, almost 12% have diabetes, and lots of them, over 50%, are pre-diabetic. Okay. There was also a paper about controlled fasting and 1 year of vegetarian diet and rheumatoid arthritis in the Lancet Journal, 1991, and the patients on a plant diet all improved. But there's no money in promoting this diet. You know, like I said, I promote the low-fat vegan diet. I'm like a beggar with this, okay? Nobody wants to interview me hardly. Nobody, no sponsor. Nobody wants me to sponsor anything, okay? You know, you do what Andrew Huberman does, sell supplements, you know, read to people out of a baby beginner book for undergraduates, and all of a sudden, wow, you're a great expert. Come on our show. Promote our supplement. Okay, I got more pride than that. You know, I spent too many of my years of my life being lonely, studying all the time. I don't want it to all have been for nothing. So I want to go out with the big guys, you know, the great ones who did it right and told the pros the truth. So you won't see me doing any of that kind of stuff. Okay, continuing on, McDougall study on rheumatoid arthritis by Dr. Mcdougall, Journal of Alternative and Complementary Medicine in 2002. The first step to getting inflammatory arthritis is to get leaky gut, increased intestinal permeability. For people with true celiac disease, their intestinal lining can be injured by wheat, barley, and rye. Okay, that's like the gluten sensitivity and whatnot. Nowadays, too, they put stuff in some of these different, you know, versions, you know, the non-organic GMO stuff. Okay, McDougall continues. To get well, the patient should follow the McDougall diet every single day, every day. If they don't follow the diet, the autoimmune disease can come back in dramatic fashion. And just one meal where you don't follow the diet, then it could give you a flare-up that lasts 7 days. So if you only do it once a week, you could be autoimmune inflamed all the time. Because again, it takes about 7 days for it to be cleared out of your body. So that's why the smart move is just never eat the wrong way anymore. You know, always eat 100% vegan, low fat. Okay, and avoiding the things that might be causing it if you think it's related to gluten. Dietary fat has a toxic effect on the intestinal lining in experimental animals, causing leaky gut. Yeah, high-fat diets are strongly associated with leaky gut. They're bad. Okay, also if you're eating animal foods, there's more bacteria on there. There's more, you know, endotoxins readily available. If eating high cholesterol diets increases the risk of leaky gut. Vegetable oils are especially damaging to the intestinal integrity, increase the risk of leaky gut. Leaky gut can lead to abnormally big chunks of protein getting across the intestinal lining. The immune system will then make antibodies to those big chunks of protein. They're big enough to cause antibody formation, and then because their sequence coming from an animal is similar to the humans, those antibodies can cross-react with the human body. So that's called molecular mimicry of our amino acid sequences on our own bodily proteins with autoantibody attacking itself, cross-reactivity. So you have a hot dog. What is a hot dog? It's just a little animal in a blender. Okay, so then there's going to be thyroid tissue in there. We can form antibodies to that thyroid tissue, and then that can cross-react with our own thyroid tissue. There's Hashimoto's disease. There's Graves' disease. Okay. The immune system makes antibodies to it. These proteins are similar in sequence to that of proteins in our own body. This can lead to antibodies that cross-react with our own bodies to attack our own body and to cause inflammatory arthritis and autoimmune disease. For example, the residues of bovine albumin, numbers 141 to 157, are highly homologous to those of collagen, and this is thought to be associated with rheumatoid arthritis. Okay, so that's a big point. You can mess up collagen from dairy because it will cross-react with this bovine albumin protein. So what else messes up collagen? We talked about glyphosate because every third residue on collagen is a glycine because it's small. It has a small side chain, just a hydrogen, so you can wrap it tight into the triple helix of collagen. So dairy screws up collagen potentially. Glyphosate screws up collagen potentially. Fluorides screw up collagen potentially. That's skeletal fluorosis, endemic fluorosis. Okay, it's thought that it'll substitute for hydrogens in the collagen muscle, in the collagen protein, and screw up the triple helix. So those are three big important things that can do it. So why wouldn't you want to avoid those things? You got problems with back pain? Well, you want to protect your ligaments. Avoid F-, avoid dairy, and avoid GP. It's pretty obvious once you understand it. Okay, rheumatoid arthritis is a very serious disease. After 20 years, 35% of the patients are dead. That's like a malignant cancer, okay? Well, that's actually not quite like a cancer. That'd be like a lower grade cancer to have 35% dead at 20 years. At 20 years, of those still living, 19% are severely disabled. So what he's basically saying is 55% are severely disabled or dead by 20 years. So that's pretty bad because a lot of people, get symptomatic at an early, young age. So anyways, that's it here for part 2 of autoimmune disease by Dr. Mcdougall. I hope that was helpful.